Welcome back to Body Beautiful. With us today, we have plastic surgeon Dr. Joseph Mele, and we are talking tummy tucks in this section. Later, we're going to be taking your calls. If you have a phone call, you have a question for the doctor, please call right now, 415-561-8753, 415-561-8753. It's on the screen there. And remember, consult your own physician before, after we give you advice, just to be on the safe side. Always good to do. All right, so let's talk more about tummy tucks. Mini tummy tucks. I've heard about mini tummy tucks. Is there such a thing?
Yes, it's kind of a hybrid between liposuction and tummy tucks. It's for the folks where the problem is confined to the area below the belly button. So if there's just fullness there, or a little bit of laxity there, or a little bit of fat in that area, I can do usually a smaller incision because it's a smaller problem, remove extra skin, tighten up that muscle below the belly button, and then use liposuction to help sculpt the rest of the abdomen. Okay,
so when you do a mini tummy tuck, you're still going to touch the muscles, but only the muscles in the lower abdomen.
Yeah, and always we only tighten it if it needs to be tightened.
Oh, okay. So sometimes muscles don't need to be tightened.
Sometimes the muscles are good and tight, and we leave them alone.
So that means the recovery is going to be even faster.
It's quicker. It is, yeah. I think the first couple of days are the hardest, but I never want to gyp somebody. I want them to have the best result possible, and I'd rather they were sore for a couple of days and get a nice, long-lasting result than not do it.
All right, what about mommy makeovers? There's this new craze now, mommy makeovers. Women are having the babies, and they just, they want their body fixed afterwards.
Sure.
So
I don't think that part's new. I think women have always wanted their bodies fixed afterwards.
But now we have a way to do it.
But it's fun to say mommy makeover.
It is.
So we hear a lot about it. And it's become kind of a generic term for any pairing of procedures that fixes the abdomen and the breast, which are the two areas that kind of take the biggest hit. So traditionally it was a tummy tuck and breast augmentation, but sometimes it's a breast lift, sometimes it's a lift with an aug, sometimes it's a reduction if the breasts stay large. And it may not be a tummy tuck, it may just be liposuction or a mini tummy tuck or something bigger, just depending on what needs to be done.
So it varies. Yes. So sometimes you may not need your breast lifted, blah, blah, blah. So it just varies with the patient. That's good to know. If you want to have more children, should you get a mommy makeover?
I think it's worthwhile to wait on the tummy tuck, and probably the breast procedures too until you're done having children. Now if it's something that's years away, then you'll have some time to enjoy the results. But if I have a patient who comes in for, let's say, breast augmentation and they're trying to get pregnant, I will advise them to wait on the augmentation.
Okay. All right, we have a phone call for the doctor. Francisco in Oakland. Francisco, are you there?
Yes.
You are on live. What is your question for the doctor?
Well, so my question is, on the inner thigh, I have overweight skin, and I was wondering what the lipo will work.
Sure.
So are you saying sagging skin?
Yes.
Okay. Will liposuction work for sagging skin?
Usually not.
Yeah.
If the sagging skin is sagging because of the weight of the fat and there's good skin tension there, then it may be helpful. But I always worry that inner thigh, if it has loose skin, liposuction alone may just make it look more loose. It'll look better in clothing because you won't have the bulge. But if it's loose, it may stay loose or even look worse. And in those cases, we do thigh lifts or something to remove that extra skin.
Francisco, are you still there?
Yes.
Would you consider doing a lift? Is it that bad?
Well, yeah.
Is it really?
Yeah.
So it is an option. I mean, it's something you want to talk to a board-certified plastic surgeon about and see what the options are, what the pros and the cons are, because it's hard for me to tell without ever examining you. It's hard to know what's the right procedure.
Thank you, Francisco. And that's another thing with women's upper arms. Boy, women hate their upper flabby arms. And no matter how many weights you do, it still seems like we have those flabby arms. So a lot of women go to liposuction, but you're saying that might not be the best bet for tightening that?
Again, it depends on the skin. If it's full, what I have is patients come in and they say, when I stop waving, I want to stop waving because this keeps going. And if that's because of the mass of the fat, then liposuction helps. If it's because the skin is already hanging down, then liposuction, again, will probably make it look worse rather than better. Whether to do an arm lift or not is a harder question because unless there's a big sail of skin there, we're trading it in for a scar, which people still may not be comfortable going without sleeves.
And it's interesting, Francisco called in. He's a man, of course. A lot of men come in asking for procedures?
Men come in for liposuction quite a bit. It's the most popular procedure, I think, for men, followed by rhinoplasty eyelids, some of the facial stuff. But for men, the gynecomastia reduction is a popular place to do liposuction, or the love handles.
Oh, the love handles, oh my gosh, so you can do something about those.
Yep.
And a lot of men want to keep it on the down low, right? They don't want to stay like they're going and having procedures.
No, I think most of my patients are that way. So
are they? Oh,
I
not
try
me.
not
I'd be like, hey. No, I'm kidding.
That makes my job easier.
Oh, it does. All right, for more information about Dr. Mele, you can call 925-943-6353. Check him out on the web, either drmele.com, sanfranciscobreast.com, or sanfranciscoplasticsurgeryblog.com. We'll be right back. Body Beautiful.